Do you feel like with ADHD, the tests that were ran to diagnose you with ADHD was just not enough? You feel like there's other symptoms and other things that might be causing of why you might be having those ADHD particular symptoms, but just don't know what tests to run. Well, in this video, I'm actually going to go over what I do specifically for my patients to run specific tests that could be underlying causes of causing certain symptoms that could be relatable to the ADHD. Hi, I'm Dr. LeGrand, and I have ADHD and dyslexia. Grew up with it, and now I actually help other people with ADHD. So if you are a parent or somebody that has ADHD, go ahead and hit the subscribe button. Also, if you like this video, give us a thumbs up, and also hit the notification bell so you don't miss out on any other future videos that we do here. So real quick, I'm going to go over my top 6 things that I do recommend as far as testing other than the typical diagnosis that you get when you get ADHD. These are things that are labs that you can actually run that could be mimicking the ADHD symptoms. So the very first one that is very common that I actually see is iron deficiency. Some kids and adults can actually experience iron deficiency, is what we call anemia, that can mimic ADHD symptoms. People who become anemic or have very low iron can feel fatigued, very brain fog, not be able to focus or pay attention. This is very symptomatic, where it can be very similar to ADHD symptoms. In lots of cases, if we actually resolve that by finding that there is a deficiency and start supplementing things with iron and also in your food base, it can help improve the ADHD symptoms. The second thing that you've probably maybe heard about this is, lead poisoning. So lead poisoning is common. It's probably not as common as you think, but it definitely does happen, where depending on how old your house was, maybe as a kid, you might have, touched things, ate things that had more lead in it, certain fish, or even when you were pregnant and your child, maybe you ingested certain things that might have caused some lead poisoning. These are things that you should maybe even just check just to rule out if there's a possibility, because if there is some lead poisoning, it can definitely cause detriment to the brain and development. So it's something that you should definitely check. The third thing would be malnutrition. So something that you can actually check that's very common that I see with my kids or even just adults that come in to see me with ADHD is looking at malnutrition. So things that are very common as far as malnutrition, especially amongst people with ADHD, is vitamin B12, and that also can be associated with the iron deficiency. There's different types of anemia, and vitamin B12 deficiency can be one of them. The other thing is also vitamin D. Vitamin D can be very low, especially up here in the Northwest. But these are things that should be checked. There's also a possibility that you're not getting enough nutrients as far as when it comes to your proteins, fats, and carbs. So seeing if your body actually digests those foods properly, which a lot of times when it comes to ADHD, there could be a lot of digestive issues going on. And if there's a lot of digestive issues such as constipation, irritable bowel syndrome, that can actually decrease the malnourishment in the body, those are things that should be checked, something I always check to make sure that we're actually consuming the right types of foods, but also digesting them properly so it can feed the body, but also feed the brain, which is very important when it comes to focusing and paying attention. The fourth thing is looking at the thyroid. Sometimes this can happen whereas if kids or adults have a thyroid issues, these can actually emulate some ADHD symptoms, because along with having thyroid issues does cause brain fog, fatigue, having a hard time paying attention, stuff that are very similar to ADHD. So it's something that you want to check to rule out. Also, it could possibly be electrolyte insufficiency. And with electrolyte insufficiency, usually our adrenals and our thyroid, lots of different parts of our organs rely off our electrolytes, and if there's insufficiency going on there, that can contribute to having a hard time paying attention, focusing, where these things should be checked. Something I always like to check, because that could be a possibility causing those certain symptoms where it might not be particularly ADHD related, but could be a thyroid, adrenal, electrolyte insufficiency situation. The fifth thing that I would suggest is looking at food allergies or environmental allergies that could be contributing to the brain fog. Now, this is something you got to go check with an allergist. Looking at IgE, that's what I only recommend, is an IgE test, not an IgG, but an IgE test is a true allergy to look at, and this could be done through a scratch test. It also could be done through blood work, but another thing that you could do is a food elimination diet. This can be really hard for kids, but if you're an an adult, this is something you certainly do, is eliminate some foods that might be contributing to the brain fog that you might be thinking of. And these are things that are common, would be wheat, nuts, milk, eggs, your most common allergies. If you want to see if to rule that out, you eliminate it for about a month or 6 weeks, and then you introduce one food at a time. This is a way that you can kind of see if there's any differences when you eliminate it and when you actually introduce it back in. The sixth and final thing is what I would suggest is something called neurofeedback. I've talked about this before, but also what it is actually looking at a brain map to see where there might be inactivity in the brain. For most people who have ADHD, it's the prefrontal cortex that there's low activity, but there might be some other parts because there's anxiety and depression that also do contribute with people who have ADHD. So seeing what parts of the brain there might be lacking and then using a treatment such as like neurofeedback to be able to improve those parts of the brain. So I hope you guys found this valuable, as far as if you have any further questions, as far as when it comes to ADHD and treatment, labs that might be run, go ahead and leave that in the comment section below. And as always, if you're new here, go ahead and hit the subscribe button right over here to find out more information about ADHD, which is what we talk about here on this channel. And you can check out these other videos right here on ADHD. So until next time, this is Dr. Legrand signing out, and I'll see you guys in the next video. Thanks. Bye.